Hello, welcome to DMSc8120 Educational Technology and Simulation. I am your professor, Bob McMullen. This is a short video explanation of the 3 assignments in this course. Or perhaps I should say an explanation of the overall project, specifically Step 1, choosing the simulation you wish to create. There are 3 assignments consisting of the syllabus for your planned course, and 5 chapters commonly used in planning simulations. Chapter 1 is the concept. What are you teaching and why would a simulation help? Chapter 2 is the design. How best to design the simulation. Chapter 3 is introduction. What do you need to include as a pre-brief for students before they enter the simulation? Chapter 4 is the actual simulation experience. What will they be doing? Is the proctor/grader in the room? How do they know they are finished? What do they do when they finish? And Chapter 5 is the debrief. When and how will each student get feedback on their performance? Individually or in a group? Written or verbal? These are the common 5 steps used to design simulations. In this course you'll design just one simulation. You will have the choice of whether you want to design a simulation for students to practice/test a skill, task or situation, or if you want to create a 5-step simulation guide for instructors to use to create their own simulation. Which type of simulation you choose to create will primarily be based on your self-assessment of your experience with, and knowledge of, simulation.
Experience and knowledge can be classified as, no, little, some or a lot. If simulation is new to you, you may have no experience and no, or little, knowledge about designing one. This is common for DMSc students who are not in PA education yet, and are old enough to have gone through school before simulation was common. If you have done some sims as a student, say for ACLS or patient assessment, then you may feel you have some experience but little formal knowledge of how to design one. This is common for DMSc students who work in the ER, or who are paramedics or nurses, who have been through simulations in training or during CME courses. You may have studied simulations before, and perhaps even been through some as a student. In this case, you might consider yourself to have little experience, but some knowledge. This is frequently true of DMSc students who have been on a PA faculty, either full-time or as an adjunct. Or, least likely of all, but still possible, you may have designed sims, and maybe taken courses about sim design. In this case, you might consider yourself to have a lot of experience and some, or a lot of knowledge. How you classify yourself, your simulation experience, and your knowledge about design and use of sims will help you choose what type of simulation you would like to design for this course.
In this course, you can complete the assignments by creating a simulation in one of 2 ways. The easiest, and probably most familiar to you, is to create a 5-step plan for simulating something. This could be a skill like CPR, or intubation, or maybe how to deal with a sad or angry patient. More difficult is to design a simulation that teaches other faculty how to design and run a simulation. One of your colleagues may be interested in creating a CPR simulation, or an ACLS station simulation, or maybe a simulation of how to perform a past medical history on a standardized patient. Let's look at each of these types of sims in greater detail. This choice is very important. Please make sure you understand the difference between the 2 options before choosing one. If you consider yourself to have no, or little experience, and no, little, or some knowledge about simulation, you may want to design a simulation to simulate something. In this case, you are the instructor, designing a simulation in 5 steps to provide a practice and/or testing environment for your PA students, or office staff, or colleagues. You are the instructor. The sim is for students. An example would be creating a sim that you could use in your work as faculty, or in your office, to practice and test the steps in wound care. I can't stress enough that this choice, to simulate something, is the easier of the 2 choices. That doesn't mean you won't learn anything. If this simulation stuff is relatively new to you, consider doing this one as you may be happier. If, however, you have more experience with, and knowledge of, the simulation process, you may choose the second option, which may be more intellectually stimulating for you. In this case you'll design a simulation that helps other instructors practice designing a simulation of their own. Think of it like CPR training, which most of you have had. Initially, as a new student, not knowing much about CPR, you take a CPR course. A CPR instructor teaches you how to do it, then simulates cases where you have to evaluate the patient and perform the correct steps, depending on size, age, and respiratory arrest only, cardiopulmonary arrest, or choking. This resembles the first choice that we talked about earlier. Creating a simulation to practice and/or test something. We can liken this second option to the instructor course for CPR. Once you want to teach how to do CPR, you must take an instructor course. To teach an instructor course, you must be an instructor trainer. The instructor teaches the newbie how to do something, and the instructor trainer teaches the more experienced people how to teach something. Option 2 requires you to move it up a notch, and create a simulation, designed to be given to another faculty member who is learning how to design simulations. An example would be explaining the concept behind creating a simulation of one of the skills in the affective domain, say, listening and empathy in end-of-life care. You would explain how to design such a sim, what factors might need to be covered outside the room right before the student enters, how the sim could be presented, and best practices for debriefing. This option places you as the instructor trainer, creating a simulation that explains how simulation should be done.
Okay, who is confused? If so, don't feel bad. Remember, you are at the relative beginning of the course. You aren't supposed to know all about simulation use and design. If this is you, be thinking option 1 for your project. If you have it pretty well figured out, understand what I mean by the 2 options, and really want to take this chance to dive deep into the metacognitive aspects of simulation, then let's talk about option 2 for you. Make sure your decision is based primarily on what you know, what you want to know, how much time you have in the next few weeks, and what you hope to leave this class knowing and being able to do with simulation. If you have any questions, feel free to email me, or come to one of the office hours I have on Zoom, Sunday and Wednesday nights at 7 p.m. Arizona time.